Good afternoon. Thank you for joining us today. From the Legislative Building here in Regina, we have Premier Scott Moe and Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab. Also joining us on the line is Scott Livingston of the Saskatchewan Health Authority. Both Premier Moe and Dr. Shahab will have remarks before we move into questions.
Good afternoon, everyone, and thank you for joining us here today. Saskatchewan's COVID vaccination drive continues to make progress, and that is thanks to the great work of many of our frontline healthcare professionals that are working so hard to deliver these vaccines to Saskatchewan people. Thus, Saskatchewan is outpacing every other province in Canada when it comes to getting those doses that we receive from the federal government into Saskatchewan people's arms. We have now administered about just over 80,000 shots. That's over 100% of the doses that we have received. The next closest province is at 86%, and the national average about 81%. So our vaccine supply, as you can see, does not stay in the freezer very long once it enters the province. Our healthcare workers, as I said, are doing a fantastic job at getting it out of the freezer into syringes and ultimately into people's arms as quickly as possible. I'm also very pleased to announce that we now have delivered first doses to every long-term care facility in the province. 91% of long-term care residents have received their first dose. The other 9% either refused or were unable to get their shot right now for some other reason, such as a healthcare issue. Of course, those residents are still eligible to get their shot when they are ready to do so or choose to do so. About 53% of those residents, our long-term care residents, have also received their second shot and are now considered fully vaccinated. I know that there is not going to be an exact moment when we can all point to and say that this pandemic is over, but there are going to be some important milestones along the way. To me, this is a very significant milestone, having our first dose of vaccine offered to every long-term care resident in the province. We all know how devastating COVID-19 can be when it enters our seniors' homes, so it's great to know that we have now provided a significant level of protection to our parents, to our grandparents, to our family members in every long-term care home in Saskatchewan. We've also delivered vaccines to 90% of the personal care homes in the province. About 78% of the residents have received their first dose of the vaccine, and about 43% have now received both shots. Of course, most of us in the province and across the country are still waiting for our first shot of the COVID-19 vaccine. We'd all like to be getting it a little quicker, I know, and it will be picking up in the next number of weeks. We are and continue to receive more vaccines on a more regular basis, and that is a positive. Saskatchewan will receive about 112,000 vaccines in the month of March. That's Pfizer and Moderna vaccines in the month of March. That's more than the total that we've received thus far this year. We also expect to receive now about 15,000 doses of the recently approved AstraZeneca vaccine in March. So things are picking up as we move through the next month. And as availability of these doses pick up, so will the availability of appointments. Last week, the Saskatchewan Health Authority indicated that appointments will soon be available online or by telephone, which means that eligible residents over 70 years of age will soon be able to call in or book an appointment online. And as deliveries pick up even more as we get through March into April, more residents will then be able to register, again, either online or by telephone. We expect to launch that appointment system next week. So for everyone who is waiting to get your shot and is in the phase 1 category, we are working to get you vaccinated as quickly as possible. And we expect, as I said, deliveries to pick up in April. So for everyone that is waiting to get your shot, like many of us, we are going to get to you as soon as we are able. Our case numbers in Saskatchewan, as well as our hospitalization numbers, continue to stabilize. The 7-day average of our new cases is now down to 144. That's down about 55% from our peak in January. Hospitalizations sit at about 154. That's down significantly from a high of 238, which was not that long ago on February the 2nd. We all know that older people, our elderly population, are more likely to have serious outcomes from COVID-19 than the younger people in our community. As we continue to make progress in vaccinating our most elderly residents first, and I spoke to our long-term care residents, we hope to see a continued decline in the serious cases as well as a decline in the hospitalizations. This is definitely the trend they are seeing in other countries that are further along in their vaccination efforts than we are in Saskatchewan or even in Canada. The truth is that the vaccines are working. They are reducing transmission, they are reducing serious outcomes, and that's very encouraging for all of us. Finally, I know many people, and I've heard from many of them, they want to see us start to relax some or possibly many, if not all, of the current public health orders that are in place. In particular, the measures that are in place around limiting our household gatherings. Well, what I would say to this is we are very close to making and finalizing these decisions. I've spoken to Dr. Shahab about this frequently. He just wants to see the new case and hospitalization numbers remain stable for a few more days. If that occurs, we should have more to say about household restrictions, possibly by early next week. We'll be taking a close look at all of the other public health orders that are set to expire on March the 19th. So I am asking everyone in this province to hang tight for just a few more days. The next number of weeks, not months, we are going to start to see things change and change significantly. Spring is coming. Vaccines are on the way. We are on the path to getting life back to normal as we know it, but we're just not quite there yet. So please, for the next number of days and weeks, keep doing what you're doing to keep yourself safe, to keep those around you safe, and to keep your family safe. Thank you in advance for everything that I know that you have done and will continue to do. Dr. Shahab?
Thank you, Premier. I don't have too much to add, but just a few points I'll go over. First of all, condolences to family and friends of Saskatchewan residents we have lost to COVID-19 since last time, I would say last Thursday. So we have had 7 residents who have passed away. And while it's little comfort to those who have lost family and friends, this 5-day period also includes 3 days with no reported deaths, which I think is significant and speaks to some extent to the positive impact that vaccinations are happening already, especially for the most vulnerable residents of long-term care and personal care homes. And we will continue to carefully compile the data to show the positive impact of vaccination in protecting the most vulnerable as our vaccination program moves forward, especially in terms of outbreaks in long-term care homes and personal care homes. And this trend, like the Premier said, both in Saskatchewan, Canada, and globally demonstrates the safety and effectiveness of vaccinations, and will continue to support our intent to vaccinate as many residents of Saskatchewan as quickly as vaccinations come. So in relation to that, we're already thinking about how will we incorporate the newest vaccine to be licensed, AstraZeneca, into our vaccination programs. As we all know, it's recommended for everyone 18 and older, licensed for everyone 18 and older, recommended on ASI, especially 18 to 64, and we'll be getting a small amount, about 15,000 doses next week. So already working to incorporate that into our vaccination program, and we'll be able to announce the details in a couple of days. Similarly, there's been some great information from the UK, from Quebec, from BC, on how effective 1 dose is for as long as 4 months. So we are working very closely with our partners in other provinces and with our federal partners, and looking forward to NACI recommendations, which we think should support delaying the 2nd dose to 4 months. And what that will do is that will really accelerate our first dose program. And if we are able to do that, we can see most of our population 18 and older potentially getting a first dose by June. And I think that would really help us in really putting the pandemic behind us. And like the Premier said, I think we all need to then be able to be ready to take any vaccine that is available when our age cohort comes up in the sequencing. But we have to remember that till such time we still have more than 100 cases a day on average. While it's declining downwards, we are still on the higher side compared to the rest of Canada. Our test positive rate is coming down. It's around 6%, and it's coming down throughout the province now. And like the Premier said, this is really the first week where we've seen significant declines in the far north, and occasionally they're still seeing clusters and outbreaks. But there is now a definite declining trend throughout Saskatchewan, including the far north and north. A bit of an up and down in Regina, Saskatoon, declining trend. South, of course, has been very low numbers, and all of this speaks to what all of us have been doing, staying the course, physical distancing, mask use when required, staying home when you're sick, and seeking testing if you have symptoms or if you have any concerns. I think these simple steps will still be critical for the next 3 or 4 months till we have the bulk of our population vaccinated with at least one dose. And I have to emphasize that especially individuals 60 and older or 50 and older with underlying risk factors, as we kind of are able to relax some restrictions, people in these age groups who have done so well so far to shield themselves from getting COVID, I think still need to observe that extra caution till they are vaccinated. And we already know that 3 weeks out after your first dose, you have a high level of protection, irrespective of which vaccine you receive. And that protection is especially significant for the most serious outcomes of COVID, which is hospitalization and death. Thank you very much.
Thank you, Premier Moe and Dr. Shahab. We'll now take questions, and we'll start in the room. Lynn?
Sure. So you mentioned speeding up first vaccine delivery doses by delaying the second one up to 4 months. What changed that now you're looking at 4 months? Like, are we potentially losing anything by pushing it back that far?
Yeah, so when the vaccines were first licensed, Moderna and Pfizer for Canada, obviously the trials had looked at second dose at 4 weeks, and we already know that UK had, right from end of 2020, the UK had started a program where the second dose was given at 3 months, Pfizer or AstraZeneca. So they have shown that the effectiveness of the first dose is actually significant, and it keeps improving all the way up to 3 months plus. But of course, they will be following up with the second dose in the UK. And then in Canada, we already knew Quebec was giving its second dose at 3 months. And their data, which is now 60 days plus, is again showing high efficacy with one dose. And so is BC data. So that's one body of evidence that's showing high efficacy with just one dose. Second is, I want to emphasize that all of us in Canada are coming out of our fall surge. For many provinces, it was a second wave. For us, it was our first true wave. And we're all just coming out. The risk of a third wave fueled by variants remains high in Canada. That's what's happened in the UK. They came out of a lockdown. They came out of the second wave. They started their vaccination program, but then they saw a devastating third wave with record hospitalizations, especially in younger people. So we continue to need to be cautious till our vaccination programs pick up. And so the question is, obviously we need to observe all our public health measures, but then how can we maximize population benefit with a known supply of vaccine? We already know at a high level how much AstraZeneca we're getting, how much Moderna, how much Pfizer, all the way till June. And how can we maximize population protection? And the way we can maximize that is giving one dose to the vast majority of people by June, and then completing the second doses July onwards. And this will help us prevent a potentially devastating, variant-fueled, third wave, and will also maximize population-level protection at no sacrifice to individual protection, because that is critical as well. Right now, the aim is clinical protection, which means hospitalization and death at a clinical individual level. But as more and more people get vaccinated, obviously we want to see the population impacts of that as well, that kind of community immunity impacts. And the most efficient way to get that, based on strong scientific advice, is to give everyone one dose going forwards till we've got the entire population who wants to get vaccinated, 18 and over, covered. And then there's strong evidence that giving the second dose 4 months out is perfectly safe and effective. But we are close to finalizing that. We're looking at data from other provinces. We're looking forward to NACI recommendations on this, and we'll be able to make a decision likely by the end of this week on that.
Follow-up?
Yeah, so Premier Moe, you mentioned restrictions potentially being loosened relatively soon too. Is there a specific threshold we're aiming to hit before that changes, or like what kind of restriction changes are all on the table for this next round?
Well, I think those discussions are still occurring. I'll maybe ask Dr. Shahab to speak to as far as not one specific threshold, but a number of factors that come, I think, into the discussion around, first of all, the household bubble, and is there an opportunity for us to have some movement there, and then ultimately the other restrictions, not removing them totally, but maybe moving to a less restrictive environment, understanding the situation that we're in, facing some of the variants, and Dr. Shahab had spoken to some of the challenges that could bring on the horizon as well, and where that intersects with the number of vaccines that we have access to, whether that intersects with where our current hospitalizations are here in the province. As we said at the outset of this effort, that we were going to ensure that we preserve the healthcare capacity here in the province. But I would just say very quickly, one thing that has the ability to really change the dates on where we start to have some very serious discussions about taking some very serious strides to getting life back to normal is that 4-month interval on the between the first and second dose. What that would mean to Saskatchewan residents, if we continue to have access to Pfizer and to Moderna in the amounts that has been indicated to us that we would have access to, we would be able to provide virtually everyone in the province their first dose by the end of June. If you add to that AstraZeneca and maybe the Janssen product, the one-dose Johnson & Johnson vaccine, between now and then we're starting to look at something in early June where we could have everyone in the province provided with the opportunity to receive their first dose of vaccine. Understanding the efficacy of that first dose and some of the data that is coming in and continues to come in, and the protection that it provides, this really is a game changer for the dates that we can really strongly have some serious discussions about the measures that we have in place and what that looks like over the course of the next number of weeks, as opposed to having that conversation over the course of the next number of months. So positive news. I think Dr. Shahab and his colleagues continue to have conversations across the province, but this should be a very high priority. If there's an opportunity for us in Canada to go to this 120-day interval, it does change the conversation, pulls everything forward significantly. But Dr. Shahab, I would turn it over to you for much more knowledge on the subject.
So in terms of specific metrics for relaxing some of the restrictions, we've always talked about the 3 key principles. One is our case numbers. So obviously our case numbers are trending down. They're about 11.8 per 100,000. So we really want them to continue trending down, preferably below 10 and ideally below 5. And we have to remember that many parts of Saskatchewan, are already reaching that level. So for example, Saskatoon is at 7.7. Most of the rural south is at less than 5. Test positivity again in Saskatoon is less than 5, 4.8%. Most of the rural south is less than 5. So already, about half the population is already reaching that safe level, and that's significant. So we want to make sure that we recognize that, but also a bit of care around Regina right now, and then a bit of care about the north and far north, and so we're having those discussions. The second thing is that we talked about the offensive strategy, testing and contact tracing. Contact tracing is still going to be important throughout the pandemic. It remains strong. They're able to manage with these lower number of cases. Testing is going to be critical. Our testing rates are good. They can be better. So we've had a few reports where people continue to work while symptomatic that resulted in a outbreak in a workplace. But in any setting, worship services, outdoor gatherings, once bubbles are allowed, we need to make sure we don't go out when we're unwell and we seek testing. That keeps you safe by isolating, in most cases, for 10 days and lets you identify contacts who can then isolate and breaks the chain of transmission. So that's the offensive strategy bucket. The defensive strategy bucket, again, it's been very reassuring to see the decrease in hospitalizations, both acute care and ICU. And now for some weeks now, that pressure is not there on acute care, that the acute care system can focus on all the other urgent and elective healthcare needs. They are critical as well, because the acute care system works at 80%, 90% capacity anyways, and now that pressure from COVID is still there, but it's declining, and we need to make sure that we keep that as low as possible. And now the fourth really important area that we never talked about before, because that was not available, is vaccination. That we already have the most vulnerable vaccinated with at least one dose. 3 weeks out of one dose, you start getting good protection. And then as we start moving down the age groups, so the next few weeks, 70 and older, and then 60 and older, and then 50 and older, the bulk of hospitalizations and deaths, unfortunately, are in people 50 and older. So over the next few weeks, we'll start protecting the most vulnerable part of the population. But that doesn't mean that COVID in younger people is not always trivial. In most cases, it's mild. But we have had hospitalizations and really deaths even in younger people. So we still need to keep an eye on overall numbers, but make sure that people who are 15 and older have the opportunity to get fully protected by one dose of vaccine as we gradually reopen, and if required. We've always had a provincial approach to public health measures, but if we need to have a more regional approach, we can certainly consider that, because, like I said, some parts of the province, more than half of the province now, has had very low rates. Some are just getting there, and some are coming into that safe zone. So this is something that we'll have to keep monitoring, both our overall rates, but also some of the settings of transmission. And again, settings of transmission, I have to re-emphasize, testing when you're unwell, testing after interprovincial travel, that will also help us to keep or minimize the risk of variants of concern taking off.
We'll take another question in the room. Steph?
Yeah. So Dr. Shahab, once we get the AstraZeneca vaccine, is the province going to be following the recommendations and just using it in people 64 and younger?
Yeah, so, in the UK, they've used AstraZeneca and Pfizer equivalently. It's the same, and, a lot of my friends in the UK who work in healthcare, otherwise, they just show up and they get the vaccine that's available. So that was their approach, and then the second dose they get after 3 months. So that's worked excellent, really well for the UK. And really, that's what I would encourage, and that's what I would expect for myself, that you show up when your turn comes and you get the vaccine that's available. But of course, NACI looked at the scientific information, and although Health Canada has approved AstraZeneca 18 and older, NACI said there's stronger evidence right now for 18 to 64. Not that it's not good for 65 and older, but that's where the stronger evidence is. So because we already have good volumes of Pfizer and Moderna coming, so we'll get very limited amounts of AstraZeneca next week, 15,000. We'll probably use it for specific age groups up to age 64, and we'll clarify which specific age groups in a few days. But then as we get more vaccines in the mix, we likely will get larger supplies of AstraZeneca coming, and Janssen as well. Obviously, depending on NACI recommendations, we'll be incorporating them into the vaccination schedule. And we have to remember, by the time AstraZeneca and Janssen supplies pick up, we hopefully will already have done everyone 65 and older anyways with Pfizer and Moderna.
Follow-up?
Yeah, Mr. Premier, your finance minister has pretty strongly suggested that your government is not going to be able to eliminate the deficit by the goal you stated on the campaign trail of 2024-25. How much longer are we going to be running a deficit for?
Well, we'll provide details, obviously, on Budget Day when, with respect to not only this year, but as we traditionally do out 4 years. I would note a couple of things. Many other provinces will only be providing or have only provided 2-year projections, and that's due to the revenue variability that I think we're all seeing, not just across Canada, but around the world, and to what level and when our government and our general community's revenues going to recover post this what will be the last 12 months throughout this pandemic. So we're working through that budgetary process right now. Would I want to balance the budget by 2024? Absolutely. Will we be able to balance the budget by 2024? We're going to see in the next number of years. But I would say that what we are not willing to jeopardize in the decisions, the discussions, and the budget deliberations that we're having are two things. One would be the services that Saskatchewan people expect from the provincial government. Those will continue to be provided. And two would be the support of this government to ensure that we can have a full, rapid, and expedient and economic recovery, which means the return of the jobs that we have lost in Saskatchewan, which have been less than anywhere else in the nation. But we want those jobs back here in this province, and we're going to be working with all of the relevant industries across Saskatchewan to ensure that those jobs do return to our communities here. So we're going to support the services that the people of this province expect, and we're going to support the full return of jobs and the economic recovery of Saskatchewan communities through and through. We have, throughout this process, been very clear that the provincial government will be here to, protect the citizens of this province with the decisions that we make alongside with Dr. Shahab, as well as many groups across the province. We're going to continue to invest in building our communities and building our economic recovery here in the province, so that ultimately, when we find ourselves on the backside of this COVID-19 pandemic, and we may find ourselves there sooner than we had originally anticipated, which is a positive thing, that we can get back to growing our communities, growing our opportunities, and growing in particular that opportunity for the next generation to stay here and build a career and have a family.
With respect, why won't you tell people the date? If 2024 is not looking viable, you're not willing to make cuts or anything drastic to stick to that goal, why will you not provide a new date, which you really highlighted was important?
There will be details that will be provided on budget day with respect to our plan to balance the budget. We've been very free, open, and transparent with our efforts and initiatives to balance the budget here in years gone by, and we most certainly will be in the years in the years post this COVID-19 pandemic. I would point as well as Saskatchewan was the very first province in the nation of Canada to introduce a budget during the COVID pandemic. We're now going to be introducing our second. We see a federal government that has yet to introduce one. We've been fully transparent with the budgets that we have introduced, fully transparent with the supports that we've provided, and we will be fully transparent with our 4-year projections. And when the budget day comes around, we most certainly will be clear with the Saskatchewan people on the plan that we will be setting out on how we are going to balance the budget here in the province, given the vast degree of variability that is in everyone's budgeting process right now.
We'll take our next question on the line. Operator?
We have Lara Fominov with 650 CKOM.
Now that we've learned that there will be 15,000 doses of the AstraZeneca vaccine coming to Saskatchewan soon, has there been any thought given to providing additional frontline workers like nurses, police, and firefighters with that vaccine?
I would say, and Dr. Shahab may have something to add, but we have about 80,000 doses of vaccine that have been delivered in order just to get through the very first doses of our phase one intake, of which many already have their second dose. But just to get through the first doses, we would likely need well in excess of 100,000 additional doses of vaccine, regardless of whether it's Pfizer, Moderna, or AstraZeneca. So there are a number of people in phase one that would be eligible to receive the AstraZeneca vaccine as we receive it, and we'll be going, and I believe that they're going through just those discussions right now as to where can we apply this vaccine to phase one individuals to ensure that we are providing vaccines to those that are most vulnerable, or working with those that are most vulnerable as soon as possible. But anything to add to that, Doctor?
Thanks. So I just said that AstraZeneca's initial supply, just like initially it was with Pfizer and Moderna, is 15,000, which adds to about 100,000 plus of Pfizer and Moderna already in the system. And if we can move to one dose and push back the second dose, then every month we're doing, a 10-year age group and moving to the next 10-year age group the next month. So I think that really has to be the primary focus, because moving through those 10-year age groups, you're, addressing the most serious outcomes from COVID first. But having said that, maybe not right away, but certainly more quickly than we had anticipated, I think all of us will be able to get that one dose. And certainly, we need to continue to recognize frontline workers, fire, police, healthcare, people working in other essential industries, trucking, grocery stores. They have worked throughout the pandemic, and certainly should I think start thinking of getting the vaccine fairly soon, in a matter of 2 to 3 months.
Follow-up, Laura?
Yes, please. COVID cases in Regina are still generally higher than they are in the rest of the province right now. Do we know how many are because of variant spread, or is there notable community spread of any variants in Regina?
Well, I would just first say, Doctor, and then turn it over to you, but this is not just specific to Regina, but the introduction of variants in Canada and ultimately in Saskatchewan is why we have moved as quickly as possible to have the provincial lab license so that we can test for those variants here, which we started, I understand, just this week, testing variants right here in Saskatchewan. I'll let Dr. Shahab speak specifically to the Regina situation, but when you Regina case numbers, sorry, but when you look at the 4 key points that Dr. Shahab had laid out before, and how we approach COVID-19 and how we approach it today with an eye as to, is there an opportunity for us to start to lift measures in the weeks ahead? Yes, we watch case numbers, which are declining. Our testing, contact tracing is a strategy for certain in determining whether we have the capacity to lift some of the measures. And one of the additions to that contact tracing and testing strategy has been the ability to test for variants here in the province. So our mechanisms there are increasing in capacity. Hospitalizations continue to stabilize or decline from where they were just back on February the 2nd, and ultimately the next number of weeks and months looks very, very positive from a vaccination perspective. So Dr. Shahab, anything on the case numbers in Regina specifically?
Yeah, so at this point, the medical health officers and public health is not confirming that the increase is due to variants of concern. But having said that, we have identified 4 variants of concern in Regina. 2 initially were travel-related, 2 are not travel-related. And we were testing 3 to 6% of all samples, primarily those related to travel, related to outbreaks, or in people younger than 50 who were hospitalized. Now, like the Premier said, the RPL is developing in-house capacity, so we could send about 120 samples to Winnipeg. Now 180 can be tested in-house for variants of concern, so that brings up our capacity to 300 cases a week. So depending on how many our daily case numbers are, we can test a higher proportion, 10% of higher for variants of concern. In addition to that, the RPL is also introducing a SNP screening test, and they can do that for up to almost the majority of samples if required, that can screen out which samples need that full genotyping. So there's additional attention being given to variants of concern. But I want to stress that irrespective of what the strain is, it behaves, while there is some indication from the UK that B117 may be more transmissible, but for the most part, all COVID strains are preventable by the simple measures that we need to continue as vaccinations roll out. So physical distancing, mask use where required, staying home when we're sick, and testing if we have any symptoms or any concerns. I think these 4 measures will, we have to continue as our vaccination program picks up over the next few weeks and months. Thank you.
We'll take our next question in the room. Mark?
Thank you. 2 Facebook Live videos broadcast this past weekend showed a minor hockey team from Estevan playing a 4-on-4 game with a referee and no social distancing in sight. Will the province be taking any disciplinary action against those involved?
I wasn't aware of that. This is the first I've been being made aware of that. It'd be disappointing if any organization is operating outside of the public health measures that we have in place, in particular given just how close we are to finding our way through this pandemic with increased access to vaccines, ultimately increased opportunity in the weeks and ahead to start to change some of the measures that we have had in place since the beginning of December. So I wasn't aware of it. I'm sure if Public Health or Scott Livingston's on the line, if you have anything to add, if you're aware of that specific situation, but I'm sure it will be dealt with in the appropriate manner.
Follow-up, Mark?
Yes, we've heard from some First Nations about reluctance to receive the COVID-19 vaccine. Is the province planning to any outreach towards First Nation communities to overcome some of the fears of vaccine safety?
Yeah, so, I think, vaccine confidence is important for all of us, including First Nations, healthcare workers, essential workers, everyone. And, overall, I think we have heard that there's a high intent of people in Saskatchewan to get vaccinated. We did see, however, in December and January that while many healthcare workers stepped forward, some took a bit of time to make up their mind, but ultimately uptake has been high, which is excellent. Similarly, uptake in long-term care residents, and as vaccination starts, 18 and older, and in some cases 17 and older is high. But again, if I think it's really important for all of us to think through that when our turn comes, will we get the vaccine? And I think for all of us, it should be clear that unless we have any specific allergic reactions to a first dose or any other contraindications, the vaccine is safe and effective, and I would strongly encourage everyone to think of getting vaccinated. And there were a few situations where there was a higher level of people in specific communities who had questions, and public health staff and healthcare providers have all worked hard to answer those questions, both by leadership and community members. And in many cases, after those questions have been addressed, vaccine uptake has improved. But again, I think it's up to all of us to get ready to get the vaccine when a term comes. It's going to come quickly. To talk to our friends and family about getting vaccinated, and to go to the Saskatchewan COVID site for information, and really look at credible information on vaccine safety and efficacy. But again, I think we'll continue to watch this closely. Right now, of course, vaccine demand is much higher than supply. But as we move forward, we really want the vast majority of people in Saskatchewan choosing to get vaccinated.
I would just add to that, the access to the vaccine, and then people, and it is their choice as to whether they receive the vaccine or not, but in general, this is our path to better days. This is our path to the days that we've been looking for what will be 12 months now. Next week is the SARM Convention. The SARM Convention last year was the last large public event that I attended. We have been in some sort of a COVID fog ever since that last SARM Convention. Next week it will be a virtual convention, and I most certainly hope that we'll be able to attend conventions of that size in the very near future. But this is our path to better days, is for people to say yes when it is their turn to have access to a vaccine. This is our path to ensure that we can keep not only our parents and our grandparents safe, but all of those elderly people in our community, or those that may be immunocompromised in our community, safe. So when it is your turn, and when you are offered a vaccine, there is only one answer that should come out of your mouth, and that is yes. They're all equally effective, the vaccines that are available, and a vaccine in our arm is far better than a vaccine that's sitting on the shelf or not being administered to someone here in the province. So from the perspective of getting back to some degree of normal in our community, keeping our parents, our grandparents, all of those in our community safe, we should all accept the vaccine when it's our turn to have it.
We'll take our next question on the line. Operator?
We have Adam Hunter with CBC.
Hi, Premier Moe, you mentioned at the start that you've heard from a lot of people that want restrictions relaxed. I'm curious as to what in your mind is the first target for you as to what would be easing restrictions? Can you give people a sense of what that may be, and why now would be the time to do that with variants out there and the concern there, and only 2% of the population fully vaccinated?
One of the things, why now, is because we do have a much larger access to vaccines in the days ahead than we have in the days gone by. For instance, I mentioned we'll have over 100,000 just of the Pfizer and Moderna vaccines that are arriving in the month of March. That'll be increasing into April. You add to that the AstraZeneca vaccines, potentially, maybe some Johnson & Johnson vaccines that may arrive as well. March is looking much better than the total number of vaccines that we have had this month. So the vaccine access is finally starting to loosen up with some additional vaccines potentially arriving here in the province. When you add to that the ability to extend that interval between the first and second doses, that allows us to reach a much larger proportion of our Saskatchewan population and get through the high priority groups with that first dose, which is proving to be quite effective in very short order. And that's thanks to the effort of our frontline staff that are administering these vaccines as soon as we receive them here in the province. And they're doing a wonderful job in doing that. If we're able to provide these first doses and have access to the majority, if not all, Saskatchewan people by the end of June, maybe early June, with the more access to AstraZeneca and Johnson & Johnson, that really changes. It really changes and pulls forward the conversations that we can have with respect to, which measures can be lifted and at which time. I would say I have received many calls on a number of different measures that are important to various people across the province. The priority measure that I hear of time and time again, and I think in fairness, one that I personally was hoping we could have made some movement on by now, but hope to in the very near future should everything hold steady for the next number of days, would be the one on expanding our households visits and our opportunities to see some family members in our households, and then move to the broader categories in the weeks after that. But all of this is contingent on one, access to increasing numbers of vaccines, which it appears we're having, but two, the ability then to stretch out that interval, which really allows and opens up opportunities for Saskatchewan people to receive that first dose, which provides what seems to be fairly strong protection in a much quicker fashion.
Follow up, Adam?
Yeah, just on that same note, would we be considering different restrictions for different parts of the province if there are evidence of higher spread in one area, problem area, or if there is a relaxing of restrictions in certain areas? Or would we consider moving on restrictions if cases spiked in one area versus another? I would just like your answer on that.
I'll maybe let Dr. Shahab, if you had something to add on that, and then I'll have something at the close.
Yeah, so, generally in November we saw a uniform increase in COVID activity, and so restrictions applied province-wide. But as we've been seeing now for 3 to 4 weeks, downward trend, more enhanced downward trend in southern rural parts of the province, and now, Saskatoon as well. Regina was pretty quiet, a bit of activity there, but hopefully that'll come under control. And the far north and north also now showing a downward trend. So I think, it's easiest if restrictions are relaxed uniformly throughout the province, and we hope that we can move in that direction. But if there's a local resurgence, I think we need to move, as quickly as we've always done. So whenever we've had local outbreaks, there's been a quick local response, and that will remain really important. And again, the key to a quick local response is people are very conscious, they monitor their health. At the first sign of illness, they seek testing. And then, we've always been able to do so many things in Saskatchewan. Worship places have been open throughout, restaurants have been open, retail areas, personal services have been open. But it's just, continuing to be thoughtful, not going out to work or, out shopping or to a restaurant if you're unwell, seeking testing, making sure your number of contacts are low. So even as some of these restrictions are relaxed, keeping conscious of all those measures. And as the weather improves, we've always seen outdoors is better than indoors. So as the weather improves, obviously even this week is looking very good. Lots of opportunities for outdoor activities continue. And as we get into spring and summer, while our vaccination rates are picking up, outdoors will continue to be better than indoors.
Really gets down at them to, the conversation around variants or vaccines in which we're going to have access to first in the general population. And it's, we're doing everything possible to ensure that it is vaccines that we will have access to before we have that broad-based access to variants in our communities. That's why we have delayed lifting some of the public health measures that are in place, is to keep the infection rate, if there are variants, and there are variants that are present in our communities, at the very minimal amount until such time that we can ensure that Saskatchewan people have access to these vaccines. So as we move forward through the next number of weeks, it would be my hope and months that we will have enough access to vaccines for Saskatchewan people that we won't have to have that conversation on are we going to treat different regions of the province in a different manner. And when you think about the opportunity, if we're able to go to this 4-month or 120-day interval on the vaccines, to have, and the addition of AstraZeneca and Johnson & Johnson, to have everyone in Saskatchewan to have access to their first dose of vaccine sometime in early June, that really changes the conversation around pulling forward those decisions on when we can reopen, if you will, or lift a number of the measures that we have. Yeah, I think it changes even further when you consider that, as Dr. Shahab had said at the outset, that the real risk of negative outcomes, poor outcomes, or serious illness from COVID-19 lies with everybody, yes, but is greatly increased for those individuals that are over 50, over 60, over 70 years of age. And with the priority vaccination process that we have, when we have one dose made available to the majority, or if not all of the people over the age of 50 or over the age of 60 years old, we should, and we hope, and what we're seeing in other jurisdictions around the world, most close to us, I would South and North Dakota, have had their hospitalizations greatly decrease with the broad-based access to vaccines. So this is our path through what has been a long 12 months for Saskatchewan people, Saskatchewan residents, and most certainly I think it's going to, as things happen in the next number of weeks and months, things are going to happen very quickly, and I just say that it can't happen quick enough.
We'll take another question on the line. Operator?
We have Connor O'Donovan from Global.
We got the good news today that all the long-term care homes in the province have received their first dose. So I think 9% of residents were not vaccinated, some because they refused. Is that refusal a concern at all that might delay the completion of that important first stage of the vaccination process and potentially easing of visitation restrictions in those homes?
Are you referring to 9% of long-term care residents that for some reason refused?
Yeah, that's right, refused or for other reasons didn't get a vaccine.
Yeah, we'll be doing a bit of an analysis on that. There can be several reasons for that. It could have been someone, a long-term care resident may have been seeking health care or may not have been able to get the vaccine at that time. Generally, for long-term care, vaccine uptake has been higher than 90%, but we'll be doing a bit of a more analysis on that. And making sure that we are able to better understand if immunization was not completed, what was the reason. And obviously it's a voluntary program, and everyone can choose, including long-term care residents, but so far our uptake has been high.
Do you have a follow-up, Connor?
Yeah, I actually received some reports that some people have been getting calls sometimes in the middle of the night that there are vaccines available. Does refusal or is that something you're aware of vaccines, I guess, maybe coming out of a frozen state and needing to be used urgently in that matter?
Sorry,
it was breaking up a little bit. Could you repeat it, Connor? It was breaking up a little.
Sure. So we've received some reports that some people have been getting calls, say in the middle of the night, to be being offered an emergency vaccination. Is that something that you're aware of happening, say in the instance of vaccines being refused, but having been taken out of their frozen state, for instance, with the Pfizer vaccine?
So maybe we can ask Scott to speak to that. We have to emphasize that, out of the 80,000 vaccines given, our wastage rate has been very low. And part of it is even though these are very sensitive vaccines, logistically challenging vaccines, Pfizer and Moderna, but once you thaw them, you do have to use them within a defined period of time, which is sometimes within hours. So if for some reason the people who are booked were not able to get the vaccine, there's always, all vaccine providers have an alternate list that they can call, and they have been calling sometimes at short notice, but actually that is resulting in very little wastage. So I think either people may know that they're on a call list, and then if they're able to go, they get the vaccine. If they're not able to go, even then you move down the list. But I think it's a credit to the vaccination providers. There's been so little wastage, because if for some reason people who are allocated to get the vaccine can't, all of them can't, we immediately move to the secondary list, and that may be one of the reasons for those calls. But I'll ask maybe Scott to speak to that further.
Thanks, Dr. Shahab. And the only thing I would add is I'm not aware of anybody getting called in the middle of the night. That doesn't mean it didn't happen as a one-off, but typically with the vaccination clinics and any extra doses, they would function just like Dr. Shahab has explained. They have a go-to list, but the clinics aren't running currently till midnight, so there could be later night calls on short notice, but they would be infrequent, because in most cases they would bring people forward earlier in the day when they know that they're going to have some extra doses.
And I haven't heard of that either, Connor, but I would just say that in general, the vaccination program in Saskatchewan is going very well. In fact, I would say it's leading the nation. We have well over 100% of our vaccines that are delivered to the province are being administered as we continue to hold our average in getting those early extra doses out of the vials. Our highest date to date was over 6,000 vaccines, which when you look at our neighbors to the east and west, given the population proportionality, is far higher than has been delivered in many other jurisdictions on a daily basis. So credit and hats off to our frontline staff that are working very hard at ensuring that they have an organized flow of people that are coming through, given the priority sequences that we have. They are most certainly, as we receive vaccines, are making them available to Saskatchewan people. It's on us to step forward when it's our turn and ensure that we are taking that vaccine, not only for our own safety, but for those around us.
We'll take our final question on the line. Operator?
We have Laura Sharpatelli.
Hi there. The NDP have demanded rapid testing for meat processing plants like Prairie Pride Natural Foods in Saskatoon, which had an outbreak last month. I'm wondering just what your response is to that.
Go ahead. If you want.
I can give an initial comment, and then Premier, and then Scott as well. But so again, rapid testing kits, both the antigen testing and PCR testing, are being quickly deployed. They've already been used for some time now in long-term care facilities. They are available to any setting which chooses to have that, and either can get trained to use it, or in future there'll be other provisions to have that testing done. But public health has right from last year, even before these current testing platforms available, has been deploying outreach teams in case of outbreak investigations to quickly do testing. So that's always been available, and certainly for high risk settings like industries where there could be a lot of people working indoors. Public health has been working along with Ministry of Agriculture and Ministry of Labor throughout, with all industries, including meat processing industries, to first of all prevent outbreaks of happening. But if outbreaks do happen, and there have been a few outbreaks recently, to quickly get ahead of that. And that again is, like you said, staying home if you're sick, testing quickly as many people working in the industry as possible, so that you can isolate people who are COVID positive and hence break the chain of transmission. And obviously in any manufacturing industry, including meat processing, it's very challenging because there's supply lines coming. It is challenging, and sometimes there can be industry impacts. But getting ahead of any outbreak in any industry, including meat processing, is critically important, both because of for the health and safety of staff working in the industry, but also the quicker you address it, the quicker that workplace can come out of it.
Scott, do you have anything to add to that?
So the only thing I just reiterate that Dr. Shahab's comment about the expansion of point-of-care testing, and we're aggressively working with with both essential employers as well as other businesses, and certainly if this particular business wants to get into point-of-care testing, we can work with them to make that happen. And then just also a highlight to Dr. Shahab's point, testing has been an integral component of outbreak management across the province since the inception of the pandemic. And I just remind that, all essential workers, all residents of the province have had access to COVID testing with or without symptoms since July 14th. And I think it's just an opportunity to highlight that we have lots of testing capacity in this province and we are underutilizing it. And it's something that people need not to forget about. And it's part of our strategy to contain, mitigate, and delay the virus as we get through our vaccination program. And going and getting tested is important today, just like it was at the beginning of the pandemic.
I would just reiterate Scott's point. We have had no restrictions on testing for many months now here in the province. We have excess testing capacity, have virtually throughout. Are addressing COVID-19. The lab and our Saskatchewan Health Authority ramped up very quickly to provide that service to Saskatchewan people. It isn't provided to all. It isn't available in all of the provinces across Canada to have that open of a testing procedure. And I again would just commend all of the folks in the front lines of our healthcare system that have worked so hard to ensure that Saskatchewan people have access to testing should they choose to do so. And now they are having in record numbers access to any vaccine that we can get our hands on in this province, and have access to that very, very quickly. And as I said again, I would just encourage everyone when it is their turn to very seriously consider getting that vaccine so that we can all stick it to COVID.
Do you have a follow-up, Laura?
Yes, I do. Thank you. Originally, we were told that the delay between vaccine doses had to be shorter than, the 4 months. Why is the province confident that 4 months between doses is a tight enough delay that people will still be sufficiently immunized and then fully immunized by the second dose?
Maybe, and please correct me if I didn't understand the question correctly. So again, these vaccines were approved, Pfizer and Moderna in December, and we started using them right away. Pfizer, a few days ago. We're going to start using them, using AstraZeneca a few days ago. We will start using AstraZeneca next week. And the recommendation so far for all 3 vaccines is 2 doses. Initially, the recommendation was second dose at 4 weeks, and we quickly, as early as January, had strong evidence that we could extend the second dose to 42 days, which we did on occasion extend it to that. But then, even then, if for some reason you can't give the second dose at 42 days, you can give it later without any concerns, and that did happen for a few days for Moderna due to supply issues in February. But now, now that the UK and and Quebec, other provinces are, entering that 3 to 4 month gap between first and second doses, they have demonstrated that first dose maintains its effectiveness, and actually the effectiveness increases over time. So now, the evidence is suggesting that it is safe to delay the second dose for up to 4 months, number one. And number two, what that allows us to do in our situation in Canada, where we have a defined supply at a time when we have some potentially high risk of variants taking off. So due to our unique epidemiological challenges, this also allows us to, within 2 months, vaccinate everyone 16 over, and then within another 4 to 6 weeks, by June, vaccinate the entire population 18 and older with 1 dose. And I think that is remarkable. If we are able to do that, that really will significantly impact COVID transmission. And then, of course, second doses must be completed, and they will start, as early as June, going on into July, August, September.
I would just say with other countries, some of the data that continues to pour in, as Dr. Shahab has said, and all that. So we've seen Quebec that has went to 90 days almost immediately. British Columbia now has indicated they're going to go to this 120-day interval. There will be a decision made here in Saskatchewan, likely in the next number of days, as if there's an opportunity to do so. But as that data continues to be clarified here for Canadian administration, and more specifically the Saskatchewan administration, if we have that opportunity opportunity, and then we combine that opportunity with the ability that we have in Saskatchewan to deliver a number of vaccines in a short period of time, and to deliver those first doses to many more people in a short period of time, bringing forward our access for Saskatchewan people to the first dose into sometime in June. This really does advance some of the discussions that we have on how we find our path back to normal. So, a very exciting time after a very long 11 months and 3 weeks. Most certainly we look forward to better times ahead. Again, I would just close with thanking Saskatchewan people for everything that they have done, continue to do, and thank them in advance for considering taking the vaccine when it's their time.
That concludes today's update. Thank you for joining us.